I stopped to stretch my leg because my left leg was really tight. And my nurse saw that.
It's 2 pounds, 14 ounces.
But what this new mother thought was just a tight muscle turned out to be life-threatening. And doctors had to move very quickly to save her life.
Close to 600,000 Americans are hospitalized each year with something called deep vein thrombosis. Tonight, in For Your Health, Ellie Merritt takes us inside a procedure that doctors are doing to break up those blood clots.
It's 2 pounds, 14 ounces.
Emily Baker delivered a healthy baby boy.
Little peanut, you want to come out?
But only after a long, complicated pregnancy. After 7 weeks of bed rest and an emergency C-section came a big surprise. Pain, swelling, and discoloration in Emily's left leg.
It kind of felt like a tight muscle, and that's why I stopped to just do some normal stretching like you would after a run.
But it was serious. Doctors diagnosed Emily with deep vein thrombosis, a blood clot that forms in the large veins, usually in the arms or legs. DVT can be chronic, serious, and lead to pulmonary embolism.
Clot from the leg would break off and can float towards up to the pulmonary arteries, which could potentially be life-threatening or fatal.
Treatments often include blood thinners, but Dr. Bhatla chose to use the Trellis device on Emily. This is it. A faster, more aggressive approach.
It's actually in the vein.
It's in the vein, breaking up that clot while we're injecting that clot buster medication.
Through an animation, Dr. Bhatla walks us through the procedure. Doctors guide a catheter behind the knee up to the clot. Balloons open up and block the area around the clot.
We activate this sort of a sine wave, this rotor-rooter, and we inject that TPA through side holes here while we break down that clot with a mechanical action.
Bottom line, it breaks up the clot and sucks it out.
This is before we use the trellis, and then this is afterwards.
You can see on Emily's images the vein is clear. A day after the procedure, she went home.
What's going on over there?
This new mom is healthy and enjoying life with 5-month-old Evan.
We feel very fortunate after all we went through. We're happy how things turned out.
And Dr. Bhatla says that the Trellis procedure is best for patients with bleeding complications and those who have recently had surgery, like Emily. With early treatment, patients with DVT may cut their chances of developing a pulmonary embolism to less than 1%. For Your Health, Ellie Merritt, NBC4.
Thanks, Ellie.